Welcome, everyone. It's Ari Berman. Thank you for calling in. We have some more updates to share with you. A lot of, this is a continuing, evolving story, and we know the importance of it and your interest, and we want to keep you updated and communicate with you the information throughout the day, and certainly this during this phone call. So let me start. We're going to be bringing in Dr. Don Weiss, who's been enormously helpful to us, and he'll be open to handling your questions as well. So I'll start with giving you some immediate updates. As I wrote this morning, we had some good news when we got the reports early this morning that the two undergraduate students who were being tested because of close proximity to the student who tested positive, including the roommate, came back negative. The test came back negative. It's very important. It indicates non-spread. Still, of course, we continue to be vigilant and continue to monitor them and the situation. I'm also happy to share with you, this is new news, that the Cardozo student also tested negative. The Cardozo student was a student who was interning in the law firm of the father, and they also were tested, and their period their 14-day period has passed as well. So thank God, they've tested negative, and that's also good news. We just to share with you a little bit about how we are working. We have a rapid response team led by Senior Vice President Dr. Josh Joseph. Many people have commented to me how quick we've responded in this evolving situation. I'll share with you that Dr. Joseph has led this response team really just way beyond this specific issue. Meaning our response team is prepared for all kinds of emergencies and situations. It's around 30 people representing 5 different campuses. When the coronavirus started to spread, even before it came to New York, we're planning the contingency plans for it. Because it was the coronavirus specifically, we brought in the Department of Health, and they've been enormously helpful to us, and they've been sitting in the room with the rapid response team and have worked on all of our plans. Everything that we've been doing has been really with the guidance of the Department of Health, and we're very thankful for it. I should also mention that we have been guiding Israel and the seminaries. All of our partners, the seminaries and yeshivot in Israel, we have been working with them and helping them as well. A couple of other updates, and then we'll turn it to your questions. We have a number of students who remain here in different conditions. Some in self-quarantine, and some who are just here on campus. All these students are well taken care of. They're being fully provided for, and services, food, and the like. As we've announced, we've continued our learning. And what we have is set up the remote access learning for our students. We have a whole series of classes that are taking place for the students. They Zoom in, and we have Zoom Torah at a code and a call. Of course, anyone is invited to listen if they want to participate. But we have set up already shiurim and Torah classes that were set up for today and also for tomorrow. Tonight, I'm very pleased to announce that we have a community-wide call on confronting the coronavirus. The call-in number is 209-399-9345. I will be introducing the talk. It will be followed by Rabbi Ari Leibowitz, the director of our Smicha program, who will do a 10-minute halacha on the halachic issues related to coronavirus. We will also have Rabbi Dr. Aaron Glatt, chair of the Department of Medicine at Mount Sinai, South Nassau, of Chief Infectious Diseases, and he'll be explaining the COVID-19. He'll be explaining the medical issues related to the virus. Dr. Rona Novick, the Dean of Israeli Graduate School of Jewish Education and Administration, will be speaking about how to speak with your children about coronavirus, and Dr. David Pelkovitz, the chair, the Gwendolyn and Joseph Strauss Chair in Psychology in the Israeli School, will be talking about the emotional impact of the coronavirus crisis. So that'll be a community-wide call on confronting the coronavirus, and everyone is invited to join us for that, so that there'll be, we can help educate on all the various fronts that people are thinking about as we work through this whole issue. Let me also announce, and again, we'll then take your questions. Dr. John Weiss is on the phone with us. If anybody has medical issues they want to raise that related to Yeshiva University. I'm also happy to announce that the NCAA has announced that the game is continuing as planned. People asked me yesterday about the game. Our team is in Baltimore, and we certainly cheer on the Max. I know I can't hear you because you're muted, but I know that in your hearts you are saying, "Let's go Max." So we are certainly cheering them on. And finally, I just want to mention in my opening remarks how really touching it is that people are helping each other and working together. I basically walk around campus in the evenings and the morning to help support the people, the students that are here. The spirit here is really strong. The people who are self-quarantined, and I've spoken with a number of students, and our students who are here are helping each other, calling each other, staying connected to one another, to really be very supportive, and it's very impressive just to see these students. I'd also add all of our facilities, the security guards, the workers. We're doing the deep cleaning. People who are here working just totally committed to Yeshiva University. The RAs, I want to tell you, it's been so amazing, so amazing. Every student that I've spoken to have spoken about how incredible the RAs have been, our resident advisors, specifically the heads, Jonathan Schwab and Natan Bienenstock. Natan and Schwab have been amazing, just absolutely amazing, and students feel very supported and very cared for, and their spirit is strong. Everyone who's here again is taking care of parents who are out of town, whose children are here. They should know that there's options for Shabbos and Purim, and everyone is being serviced and cared for. And I'd also say just a big support, thanks, and gratitude to all of the parents and families, the Yeshiva University families, and all of our greater community for the just overwhelming offerings of support and help. Somebody just sent in these care packages for the students, 250 brownies, 500 chocolate chip cookies, 120 fresh-made challahs, and more. Okay, not that they need the food, by the way, but it's always nice for them to get it. It is nice, and we really appreciate everyone's support. So these are some opening remarks. I sent out the letter yesterday that was very detailed in what we're doing and in giving guidance to the students on their next steps and what they should be doing. And I'm going to open it up now for questions again. Dr. Weiss has a couple of words that he's going to share as well, and then we'll open it for questions. Dr. Weiss, I just want to say one thing before I put on Dr. Weiss. Dr. Weiss has been simply amazing. We should round of applause, Dr. Weiss. Let me say, everybody should round of applause to Dr. Weiss. It's not just his medical advice and guidance and direction, but he's also worked to get our students tested, and that has been, he's been so important. He's been embedded in this institution, and we are deeply, deeply thankful to him. Dr. Weiss, please, thank you so much. If you can open with your comments.
You're welcome. Thanks for that gratitude. I appreciate it. So I think the situation at Yeshiva has been well handled. As you know, there was one student, his roommate, and the child on the floor were tested negative. The roommate is going to stay in quarantine for, I think it's about another week, because he qualifies as a close contact, and the school will continue to support him there. The other children on the floor, we only recommended that they social distance and not congregate. And the fact that the other student on that floor was negative is encouraging. I think it's important to realize, that this is a relatively new virus, so we're constantly learning more and more about it. And that for the best knowledge that we have at this present time is it's transmitting like flu, and for people who don't have any health problems and aren't elderly, that it won't cause an illness any more than the flu, and in many cases milder than the flu. So I think there's a lot of room for people to take a deep breath and try to relax and put things in perspective and try to go on with their life. I got back to the health department around 3 today, and I spent the next 2 hours on calls with people from the community, especially the community out in Westchester, because they're not getting the guidance that is clear to them. And every day I was on with, I don't even remember his name, he was from the SAR school. He was reading to me as he was getting emails that another school was closed and another school was closed and someone was thrown into quarantine. So we're following the guidelines put forth by the Centers for Disease Control, and these are published on their website.
Okay.
They're very clear. They're very clear. So if you've had close contact, meaning you're a household contact with a proven case, that's when you're put into quarantine. But these people who are in a ceremony with someone who was tested positive but not actually sick, this is the area where it gets very gray, and we're not recommending that we limit the activities of any of those people. And that's why, you might be hearing different things from the students from Yeshiva than people who are living in Westchester County. And maybe I'll just sort of stop there and see if there's any questions.
Okay. Thank you. First question, if most people are asymptomatic, is there a concern that someone will self-quarantine for 14 days, show no symptoms, yet still be a carrier and able to spread the virus?
I just want to make a clarification. We don't know that most people are asymptomatic. We know that most people have mild symptoms. The asymptomatic people, we don't even know if they exist. There are only a few that we know of because they were swabbed when they were negative. So there's a couple people up in Westchester County. So we don't know how many there actually are. There could be a lot. We don't know. And as far as transmission from them, we still don't know much about that either. The general thought is that if you are exposed to the disease, you're going to get sick within a week, usually around 5 to 6 days. If you don't, we don't know what that means, but it could mean that you successfully fought it off and you're not going to get sick. But like I said, we're still learning about the virus.
Okay. I am under the impression that coronavirus affects people with diabetes more than others. I would like to know what type of diabetes, type 1 or type 2, or what other illnesses would be of more concern when they contracted coronavirus.
Sure. So because it attacks the respiratory system, so any chronic disease of the lungs would be of concern. So asthma is a concern. People who have chronic obstructive pulmonary disease or chronic bronchitis would be a concern. Both type 1 and type 2 diabetes do affect your immune system, and that's generally as you age with it. So it's generally people who are older with those illnesses. And then any other illness that's going to affect your immune system. If you have HIV/AIDS, if you're on chemotherapy or immunosuppressant therapy, had a kidney transplant, things like that. Those are the situations that would make you not just more at risk for this, but more at risk for lots of different infections.
Okay. Next question is, will there be class on Wednesday and Thursday?
Yes, so that is, we are planned to be open on Wednesday and Thursday. And, of course, this is an evolving story. If anything changes with that, we will let you know right away. But the plan is to be open on Wednesday and Thursday.
Okay. What symptoms should someone look for to go into self-quarantine?
Well, let's put some qualifiers on that. So that if you have no contact, you don't have any contact at all with anyone who's had this disease, and you come down with flu-like symptoms, meaning you have fever, sore throat, muscle aches and pains, and cough, we would tell you to do the same thing if this was last year. You should stay at home when you're sick until you're better. If you have had contact, or for some reason think that you might have had contact, then the recommendation is still going to be the same. Stay home. Now, if you're one of those people who has one of the chronic conditions that we talked about, and you get this disease, even if it was last year, because flu can make you sicker with all the diseases we talked about, it would be advisable for you to contact your healthcare provider and see if they would like to see you. In any circumstances, if you're not getting better, if you're getting worse over the days, or if you have at any time shortness of breath, that's a reason to access the medical care right away. Now, what's happening now, and we're starting to see it, and this is not really a surprise, is that we're seeing these cases in people who did not travel. And what that means is that it's in the community, and it's being spread from person who traveled to someone who didn't, to someone who didn't. And then so you're not going to know whether you would be at risk. So the recommendation is still the same. If you have flu-like symptoms, as we mentioned, stay home until you're better.
Okay. Do classmates of the student that tested positive need to be tested also?
Well, we covered this a little bit, I think. We don't have the resources, and it's really not a good idea to test someone who's not sick. There's a number of reasons for that. The main reason is that we need to test people who are sick and in the hospital, because it has lots of implications of how their treatment goes. If we're using up all our tests and all our test time on people who aren't sick, then the healthcare workers taking care of those patients in the hospital are going to be put at risk. The patient is going to be put at risk, and it's not good for the city as a general. The second thing is that if you get a test result, it's very hard to interpret what it means. So if you have a negative test, that doesn't mean you're free and clear. The next day you could get exposed and you could get sick. So are we going to end up testing people every day to make sure you're okay? That's unrealistic. If you end up with a positive, we still don't know what that means, because this test just tests for the presence of the genetic material of the virus. It doesn't test if the virus is actually able to cause infection. So a person could have been exposed to the virus, fought it off, still have some of the genetic material in your nose and throat, and we don't know what that means. They may never get sick. So for that reason and a number of reasons, we don't think it's a good idea, and we're not doing it here in New York City, to test people who don't have symptoms.
Okay. Should there be any concern about flying domestically?
Oh, okay. So this is sort of a general question of whether or not you should ever get on a plane right now. Well, as you probably know, if you've ever flown a long flight, very often you'll walk off the plane and you'll get sick because the air is recirculated and people are coughing and sneezing. You got 300 people on a plane. So if you can avoid it and you're a person who has any of those health conditions, then maybe you wouldn't want to fly right now. But if you're a person who's got a good immune system and you have to go to a business meeting or you have a vacation plan, I certainly would go on it.
Okay. Thank you. Are there any other YU students or faculty members that have tested positive for the virus?
I'm happy to say that there are no YU students or faculty members that have tested positive for the virus. The only case is the one that people know about. There's been no other YU students or faculty member tested positive.
Okay. As a precautionary measure, will students have the option to remain off campus and attend classes virtually?
So right now, we certainly have been working on contingency plans, and we'll see as that develops. Right now, we are under the working assumption that classes will start on Wednesday, and if anything changes with that, we will let you know.
Okay. This is a follow-up to the flying on an airplane question. Is there any reason to avoid the subways?
I don't think so. I think it's very difficult to get around New York City without using the subways. What I would recommend people do is wash your hands when you get out of the subway. You have to touch the rails, otherwise you might fall, and that could be dangerous. Before you get to wash your hands, just be careful not to touch your nose, your eyes, or your mouth. Just to be on the precaution. And this is not just for coronavirus. This is for flu and all the other viruses that you can get by being around other people.
Okay. Would it be safe to spend time in the Beit Midrash and in synagogues?
Well, I would say the same thing that I said before. So, I got this question earlier in the day. My grandparents are in their 80s. They're not totally well. Would it be okay if I spent time around them? And I flipped it the other way around. The suggestion would be they should, if they're worried about their own health, they should stay away from other people and not make you stay away, because they're the ones who are going to get sick if they encounter people. So, I think normal, healthy people should go about their business as normal. If you're worried that you've got a fragile health condition, then maybe stay at home for the next, and it's going to be a while. It's probably going to be a couple months before we see this kind of work its way through the community and be done. And that's just a guess on my part based on what's happened in China. Another 2 months worth. It's like the groundhog didn't see his shadow. He didn't see his coronavirus shadow. And we got 2 more months of this to deal with.
Right. Okay. Is YU Purim still canceled?
So I should be clear. YU, we have canceled Parshas. We had a special Shabbos, Yeshiva Shabbos, and Shabbos Zachar. The Shabbos has been canceled. Monday night, the Chagiga, the Purim Chagiga, and the celebrations that we annually are canceled. Purim as a holiday, of course, still exists, and we look forward to celebrating that. Tonight, please join us tonight for the call with Rabbi Aryeh Leibowitz. We'll talk about in the 10-minute halacha about what the community should do for Purim and how to celebrate Purim this year. So join us for that call. The information has been spread, but that call starts at 8:30 tonight. And we'll discuss all of the halachot, all of the laws and, legal ramifications of making sure that we're safe, that we keep safe as a community, which is, of course, the highest priority, to keep safe and be able to celebrate Purim this year.
For a YU student who does not feel any symptoms, should he avoid being around the elderly? I think we addressed that.
I think Don addressed that. Yeah, Don addressed that already.
Okay.
Yeah, if you don't have any symptoms, I think it's fine to be around your relatives.
Okay. Does vitamin C help in this situation, in any situation?
Well, there's been no studies to that effect, so I could not suggest that it would.
Okay. Is there a plan in place for out-of-town students in the event that there is a coronavirus outbreak among the students?
So all the out-of-town students, anyone who's in Yeshiva University is fully taken care of, services, food, and we will continue to care for them. There's no question about it that there's a place for them, that they will be serviced.
Yeah. Will YU be advising professors to push off midterms scheduled for the end of next week?
So you have to speak to the faculty. It's very important. Faculty will be connected, and speak to your faculty to ask specifics for the what's happening in each of your classes. I should also say that many of the people on this line might be members, our staff and our professionals and our faculty. And, of course, everyone is, as I've written and we've spoken to, should be, as I'm sure already has, but spoken to their supervisors about the possibility of working remotely.
Okay.
Okay, so it looks like a lot of these questions are repeat questions. I think we've covered most of this information. It's very, it's important for us that we remain in communication with you. We'll continue to communicate, and as I wrote in my letter, to over-communicate even, that, as Dr. Weiss has mentioned, the calmness of this and being able to, approach this as fully informed and understanding the steps. It's very important for our community. It's very important for our students, faculty, for the broader Yeshiva University community, and we will continue to remain in touch and to write. And I encourage you to please check our website, to follow us on social media. We're going to be sending out updates regularly, and we're putting out an FAQ sheet for the many questions. We have a lot of repeat questions that we've written up for you, because we know that a lot of people have very similar concerns. So you can check up on the website, and you'll see that as well. That should be going up later. And I think that with all of us working together and thinking and keeping vigilance on our medical condition, we will get through this and we'll emerge even stronger as a community. So thank you so much, and we look forward to continuing speaking with you. And everyone should have a refuah shlema, and Hashem yirachem. We certainly think about those who have been infected by this virus, those who are sick, and they are in our tefillot. And we believe that coming together as a community in tefillah, in faith, in compassion, and in kindness, this is the way forward for us. So we look forward to speaking to you soon. Thank you, Dr. Weiss. Again, you've been an incredible pillar of support for us, and we truly, truly appreciate all of your help. Thank you, Dr. Weiss, and thank you for everyone to be on the phone. Thank you so much.